It's Wendy Bowen, physiotherapist with Know Your Body Better. So today I want to talk with you about the pelvis. So what we see with the pelvis is you've got these two wing bones called innominate. This is the sacrum or the tailbone that sits in between them. You have very, very strong ligaments that help hold that in place. But there are muscles that help move these bones a little bit. This doesn't move very much, but it does move forwards and backwards within this joint. And as it comes forward, the ligaments tighten down and stabilize that joint in there. The glute muscles will pull on the pelvis, so will the pelvic floor muscles that are down under here. At the front, you have your thigh muscles and your adductors that attach in here, and at the back, the hamstring. So what I've seen the last couple of weeks are people who have a little bit of a twist or torque in their tailbone. And what happens is one side's locked down, the other side gets locked backwards, which makes it very hard to bend. And a lot of times you can't bend backwards, or sometimes you can't bend forwards without the pain. It may create a sciatic pain going down the back of the leg. So what I'm getting in there and doing is mobilizing or manipulating this joint back into place after I release the muscles that are holding it tightly. So there's a couple things that you might be able to do to release those muscles yourself. So when the tailbone gets a little twisted, one of the things that I have done in the past for myself is lie on my back, squeeze the buttocks as tightly as you can, and that usually makes the pain feel less. And then as I squeeze, I've lifted up, and I actually have got a pop out of my tailbone. The other way to help mobilize your own tailbone, if it feels like it's stuck, and again, this should feel like it's feeling better, not worse, is you lie down, but you take a small towel, roll it up like this, you put it right on your tailbone area. I get my clients to lie on my back, lie on their backs like this, so that towel is sitting on the tailbone. Now if I want this side, if this is the side that's stuck, then what I'm going to do is bring this knee up to the chest, and what that does is take that wing bone, that innominate, rolls it backwards while I'm putting some pressure on my tailbone. And again, this should feel better. It should feel like, oh my gosh, that's feeling so much better as you do it, not worse. If it's the other side that feels stuck, then you just do it on the other side. And again, what you're doing then, grab my pelvis, is you're placing the towel here, which would be my hand, and as you bring your knee up, you're rotating that back but holding that. So you're mobilizing your own tailbone area. So there are some things you can do, but if you're finding that you're not getting it, then get in to see your healthcare practitioner, your physiotherapist, perhaps a chiropractor, massage therapist. Let us help you help yourself. So it's Wendy Bowen, physiotherapist with Know Your Body Better.